When you hear the word melatonin, you immediately think about sleep. You might have tried it when you had problems with sleep, and chances are that it might not have helped, as melatonin usage is nuanced and sometimes misunderstood. Though there are a lot of studies made about melatonin, and even though it's tightly linked to sleep, it actually can help with a lot of things throughout the body. And I believe we will be using it more in the future as we continue to discover its other use cases. In this video, I want to share the current knowledge about melatonin and how it can help. Just like we understand vitamin D as a vitamin of sunlight, we can think of melatonin as a hormone of darkness. If you don't get enough sunlight, then you might be lacking vitamin D, as well as if you lack darkness, you might be lacking melatonin. In fact, we are very sensitive to light, and even minor light sources at night can disrupt melatonin production. Also, you need to be aware of blue light sources like phones and computers. As I already mentioned, melatonin isn't just helping you to fall asleep. Melatonin is actually a very powerful antioxidant, immunomodulator, anti-inflammatory, and it has heart protecting and cancer protecting properties. Though, let's go through different body systems and see what melatonin can offer. The central nervous system. Melatonin has a powerful effect on our sleep and can advance or delay when you want to go to sleep depending on when you take melatonin. This effect has been widely used to curb the time to recover from jet lag or improve the sleep of night shift workers. Melatonin is also effective for insomnia if taken just before sleep, and it also helps regulate sleep in blind individuals. Melatonin also improves the cognition of Alzheimer's patients and delays the progression of the disease. If you are having migraines or headaches, melatonin can help as well, as several studies have indicated a reduction in migraine frequencies and a reduction in the intensity of pain. Melatonin can also help improve tinnitus symptoms. Melatonin seems to be promising in cases of ADHD and autism when patients have lower levels of serum melatonin and have phase-delayed sleep. The heart. Improvements in LDL cholesterol and blood pressure have been shown in as few as 2 months of melatonin use. Melatonin also helps with pulmonary hypertension. Other studies have shown that melatonin improves outcomes in patients with heart failure. And overall, melatonin improves all kinds of vascular health biomarkers like blood pressure. Reproductive health. Because pregnancy has increased oxygen demands on the body and thus more free radical damage, melatonin supplementation may be a consideration for pregnant women. It has been hypothesized that oxidative stress negatively impacts fertility. Since melatonin is a strong scavenger of oxidative factors, it could improve both male and female fertility, but this needs to be proven by further studies. If you have endometriosis, melatonin is a cheap supplement to try out that can reduce pain. For treating polycystic ovarian syndrome, melatonin seems to be a very powerful supplement as it helps balance out the hormones and improve other symptoms. The gut. Melatonin has been proven effective for several gut diseases. It helps improve the symptoms of irritable bowel syndrome if you are having diarrhea or constipation. It is also effective in treating GERD, and probably most impressively, it's very effective in treating H. pylori infections that already have ulcers. Also, melatonin is effective in oral care, like improving periodontal inflammation or protecting from dental materials after dental surgeries. Autoimmunity. Melatonin seems to be a very promising supplement for improving symptoms of 2 autoimmune diseases, multiple sclerosis and Hashimoto thyroiditis. Studies have shown that melatonin supplementation increased the quality of life in both of these diseases and reduced inflammation biomarkers. Also, melatonin helps regulate the immune function overall and is a powerful anti-inflammatory. Cancer. Melatonin and cancer research dates back 30 years ago, and there is good evidence for cancer patients to take melatonin. One study found that high doses of melatonin taken before chemotherapy increased its effectiveness. Melatonin is also helpful for dealing with various cancer symptoms like disrupted sleep, fatigue, anemia, and depression. Other lab studies show promise in using melatonin to downregulate tumor cell survival. Bone health. One promising study was made where melatonin was given in a cocktail supplementation together with strontium, D3 and K2. In that study, the patient's bone mineral density increased, though further study is needed to see whether melatonin alone is beneficial for bone health. How to increase your melatonin. Melatonin is secreted in the pineal gland. A typical human makes from 0.1 to 0.9 milligrams per day. As we previously talked, melatonin can be thought of as a darkness hormone, and having proper sleep hygiene can help with that. Avoid blue light 2 hours before sleep. At the very least, use apps to filter out blue light from your screens. Make sure that your bedroom is clear of any artificial light, and also thick curtains are a must to block all the light from outside. Just my hypothesis, but I think the melatonin and light connection can answer why we sleep poorly during a full moon. Now, if you're doing all this, then you should have pretty good levels of melatonin. But if for any reason you want to increase them even more for treating different conditions, then supplementing is the way. Supplementing with melatonin is safe. In low levels it is found in plants and it is very well tolerated, though there isn't any food particularly rich in melatonin, so melatonin is usually taken in synthetic form. Now the most common dose is 1 milligram per capsule, which is more than a typical human makes in a day, though the melatonin you take as a supplement is usually 6 times less effective than what you make yourself. A lot of studies for treating different diseases usually use a dose of 1 milligram per day, and some cancer studies have used 10 milligrams or even more. The one study in particular has tried to answer what dosages are optimal, and they found that 0.1 milligrams was too small and doses of 1 milligram weren't any better than 0.3 milligrams. So if you're taking a 1 milligram tablet, then for sure you can cut it in half. Overall, melatonin is a very powerful molecule responsible for a plethora of things throughout the body and can help with a lot of diseases and conditions. Though through all my research on melatonin I kept getting this thought: could we replace the word melatonin in this video with a good night's sleep? As it seems to me that if you have proper sleep hygiene and get plenty of darkness, then you will secrete enough melatonin and you will have high quality sleep, which will lead to all these improvements in different conditions. Though you can't prescribe a person to turn off their screens before bedtime, but you can prescribe melatonin.